Deglutition. Deglutition is a process where the food is transferred from the mouth cavity into the stomach. It can be divided into three phases. The first one is the buccal phase or the oral phase. The second one is the pharyngeal phase. And the third one is the esophageal phase. The buccal phase. This phase is voluntary. In this phase, food is made into a bolus on the dorsum of the tongue. The soft palate is pushed upwards and backwards, while the posterior pharyngeal wall moves forwards. Thus, they become opposed to each other to shut off the nasopharynx from the oropharynx. The bolus is pressed by the tongue against the hard palate. This forces the food into the pharynx. Secondly, we have the pharyngeal phase. In this phase, the epiglottis is pushed back by the food entering into the pharynx. The epiglottis now lies in a transverse plane covering the laryngeal opening. The laryngeal opening is closed by the apposition of the vocal cords. At the same time, the larynx is lifted up by the contraction of pharyngeal muscles. The respiration is stopped. The upper esophageal sphincter undergoes relaxation. Food now enters into the upper part of the esophagus, propelled by contraction of the superior constrictor muscle of the pharynx. Thirdly, we have the esophageal phase. As the food bolus reaches the upper part of the esophagus, the upper esophageal sphincter contracts. A peristaltic wave is initiated, which, aided by gravity in the upright posture, may send the bolus into the stomach. This is known as the primary peristaltic wave. However, when the primary peristaltic wave fails to transfer the bolus into the stomach, secondary peristaltic wave is initiated by the stretch on the esophageal wall by the bolus. The bolus is now finally pushed into the stomach. The lower end of the esophagus, like the upper end, is guarded by a sphincter called the lower esophageal sphincter. It is composed of three groups of muscle fibers that includes smooth muscles of the esophagus, crural fibers of the diaphragm, oblique muscle fibers of the stomach, which act like a flap valve. It prevents backflow of gastric contents. It is 2 to 6 centimeter long and is under neural and humoral control. It remains tonically contracted so that the intraluminal pressure at this site rises to 30 mmHg. The sphincter relaxes at the advent of a peristaltic wave and food passes through it into the stomach. Factors relaxing the LOS, that is the lower esophageal sphincter. The first one is parasympathetic discharge or the vagal discharge, which relaxes circular muscle layer. The second one is VIP and NO secreted by intrinsic nerve endings. Factors keeping the lower esophageal sphincter contracted and preventing gastroesophageal reflux are sympathetic stimulation, gastrin in large doses, flap valve action of oblique muscle fibers of the stomach, crural fibers of the diaphragm surrounding the lower end of esophagus also play an important role, which is called the pinch-cock effect, in preventing gastroesophageal reflux. Although initiated voluntarily, deglutition involves a series of well coordinated reflex activities for the smooth operation of the process. The center of the reflexes lies near the respiratory center in the brainstem. Afferents are carried by the 5th, ninth, and the 10th nerves, while the efferents pass along the 5th, 7th, and 12th nerves.